Honorable County Commission meeting is open now pursuant to adjournment. The Honorable Chairman John Gardner presiding.
Thank you, Sheriff Cassidy. I'd like to welcome everyone to the meeting of the Sullivan County Commission, Thursday, May 21st, 2026. I invite you all to remain standing at the end of the pledge delivered by our own Sam Jones from District 7. First, I'd like to recognize Commissioner Larry Crawford for our invocation.
Let's bow for prayer. Oh God, it's with thankful hearts that we come before you this evening to give you thanks for the wonderful life that you provided for us, the portion of health that you provided as well. Direct our hearts and minds as we go forth in this meeting this evening. All of this I pray in Christ's name. Amen.
Amen.
Attention, salute.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Recognize Commissioner Jones at his desk for an announcement.
I've also been asked to announce our Memorial Day services that are going on here tomorrow at 10 o'clock. Sullivan County will have their Memorial Day service at the Veterans Memorial, which is behind the original jail at the Veterans Memorial at 10 a.m. Monday, we will have the Veterans Day service at 11 a.m. in Kingsport at the Veterans Memorial there. And the Honorable Richard Venable will be our speaker in Kingsport. Retired, I don't know if he retired, Travis Featherstone will be speaking here tomorrow. Thank you.
Thank you, Commissioner Jones. Members, when the board opens, please record your presence. Has every member recorded their presence? Madam Clerk.
22 present, 2 absent.
Thank you, Madam Clerk. We have a quorum. The May 2026 meeting of the Sullivan County Commission is in session. Our first order of business is approval of notaries. Madam Clerk, we have a list of notaries.
We did. Patricia A. Agno, Mary P. Barkley, Katrina Levens, Brady L. Boyd II, James Randall Brooks Jr., Charlene Michelle Carnes, Rebecca R. Carter, Sarah Ann Chapman Williams, Chase Sullivan, Christy Egan, Paula Freeman, Stacy Galloway Lester, Lisa T. Gibson, Erica R. Rivetts, Houston E. Harris, Morgan Elizabeth Harris, Wesley Eugene Harris, Nikki Ray Hensley, Eleanor W. Holman, Victoria Hudson, Rachel E. Johnson, A.D. Jones Jr., Andrea N. Knapp, Raymond Cole Landry, Wendy Lane, Elizabeth Lupu, Deborah A. Martin, Elizabeth McLean, Melissa Moore, Carrie Denise Mullins, Jennifer Raines, Brianna Page Rasnick, Molly H. Reese, Alicia Lane Shoup, Parker Christian Smith, Adrian Smith, Cindy K. Sproul, Heather Leanne Stroop, Cody Thompson, Melissa Lynn Tomlinson, Nicholas Turok, Letitia Turner, Carolyn Underwood, Carlos Andrew Villa, Kathleen J. Wagner, Karen Mary Watson, Kevin M. Weiser.
Thank you, Madam Clerk. You've heard the list of notaries as presented. Is there any discussion on the notaries as presented?
Motion to approve.
Motion to approve by Commissioner Cole, second by Commissioner Cross. Is there any further discussion on the notaries as presented? Without objection, when the board opens, please cast your votes on the approval of notaries requiring 13 votes for passage. Has every member voted? Does any member wish to change their vote? Madam Clerk.
22 yes, 2 absent.
Having received the necessary majority of the votes cast, the notaries are approved. Without objection, next order is approval of minutes of Board of Commissioners of Sullivan County, March 12, 2026, rezoning hearing March 19, 2026, monthly meeting April 9th, rezoning hearing and work session April 16th, monthly meeting. Is there any discussion on the approval of minutes as presented?
Move for passage.
Second.
Proper motion by Commissioner Crawford for passage, second by Commissioner Hopper. Is there any further discussion on the approval of minutes as presented? Without objection, when the board opens, please cast your vote on the approval of minutes requiring 13 votes for passage. Has every member voted? Does any member wish to change your vote? Madam Clerk.
22 yes, 2 absent.
Having received the necessary majority of the votes cast, approval, the minutes are approved. Next order, on presentations and proclamations, I'd like to invite Sheriff Cassidy, if you will, sir, to the well. Sullivan County Sheriff's Office received 10th Meritorious Award presented by Vincent Dora, Regional Planning Director of the Commission on Accreditation on Law Enforcement. Recognize Commissioner, Sheriff Cassidy.
Yeah, thank you, Chairman.
I just noticed you, sir.
Thank you so much, Chairman. I'd like to introduce Vincent Galro from Alabama. He's the Regional Program Director for CALEA, which is the Commission on Advanced Law Enforcement Accreditation. So Vince just wants to say a few words about the process.
Good evening. On behalf of the Commission on Accreditation for Law Enforcement Agencies, the Commission Chair, Colonel Matthew Paxton of Colorado State Patrol, and Executive Director, Mr. W. Craig Hartley, thank you for welcoming me to present the 2026 Accreditation Award for the Sullivan County Sheriff's Office. CALEA was created in 1979 when the founding organizations, the International Association of Chiefs of Police, the National Organization for Black Law Enforcement Executives, the National Sheriff's Association, and the Police Executive Research Forum, recognized the need within the law enforcement community to establish standards to enhance the delivery of police services to citizens throughout the communities they serve. CALEA is the only internationally recognized public safety accrediting body, and we serve the United States, Canada, Mexico, and Barbados. Since its inception, CALEA has accredited over 1,600 agencies under standards developed by many of the leading public safety practitioners of our time. Gaining an internationally accredited status is a distinction held by very few. There are over 18,000 law enforcement agencies in the country. So that equates to just below about 5% of the agencies in the country are accredited. Currently, there are 31 agencies in Tennessee that are internationally accredited in the law enforcement program, with 5 of those being sheriff's departments. The goals of CALEA are to strengthen crime prevention and control capabilities, formalize essential management practices and procedures, establish fair and non-discriminatory personnel practices, improve service delivery, and solidify interagency cooperation and coordination, and also increase community and staff confidence in the agency. Many agency heads are reluctant to have outsiders review their work and administrative practices while detailing any deficiencies the agency may have. It involves risk. It also requires the department to be open to change and demonstrate that they conduct their departmental business in a way that meets contemporary law enforcement standards. Sheriff Cassidy thinks otherwise. He understands that CLIA accreditation minimizes his agency's liability exposure, demonstrates accountability to the public, and guarantees professional management practices. In practical terms, the sheriff believes that it confirms their commitment to excellence in law enforcement. Based on the goals and mission statement of CLIA, I can think of no better time to present this certificate than a meeting of the commissioners, where everyone can recognize the hard work this agency has committed toward accomplishing this goal. The certificate that I have today is simply a matted paper within a frame, but it has a much broader symbolic meaning. It clearly represents the agency's efforts to achieve accreditation, thereby demonstrating its willingness to change and effectively address contemporary public safety concerns. It represents the commitment to doing the right thing, the right way, for the right reason. It represents adherence to a professional code. Lastly, it represents the ongoing dedication to ensuring the agency's resources are appropriately developed, effectively deployed, and constantly managed, all in the name of a safer county for citizens and visitors alike. During the previous 4 years, CLIA staff remotely reviewed the agency's food compliance funds. Then on October 13, 2025, a professional assessor visited the sheriff's office, reviewed the agency's administrative activities, functional impacts, and management strategies. Using this process, CLIA staff and an outside assessor determined that the agency was in compliance with all applicable standards. The assessor also noted that the agency is committed not only to the standard process, but to the intent of the process, and accordingly exemplifies what accreditation represents. During the site-based accreditation assessment, the assessor conducted 20 in-person interviews. They included members from partnering agencies, associations, members of the community, and I believe someone on this board. All of the people that they interviewed said that the Sullivan County Sheriff's Office and Sheriff Cassidy are very committed to serving their community with the highest level of professionalism, assuring the needs of the community are at the forefront. Accreditation principles are deeply embedded in the agency culture, not treated as a periodic requirement, but as an ongoing mechanism for organizational growth, operational excellence, public accountability. The department fosters transparency, integrity, and accountability across all their practices. The assessor found the agency's personnel were proud to be members of the sheriff's office and were reflective of the professional attitude with a high sense of service to their community. At the commission meeting held in Tucson, Arizona, the CLIA commissioners reviewed the assessor's report, concurred with the findings, and unanimously voted to reaccredit the agency. This is the agency's 10th award for law enforcement accreditation. They have been continuously accredited for 30 years. Now, I'd like to ask Sheriff Cassidy and the agency's accreditation manager, Ms. Dawn Ford, to come forward to receive the CLIA accreditation certificate. I'd like to also note that none of this would have been possible if not for the hard work performed by the sheriff, his command staff, you, the members of the governing body, and the people standing and sitting behind me. It is not just one group that does this, it's the entire community. And I'm gonna turn around if I can and read this because it's for them as well. Sure. Everybody knows that Sullivan County, Tennessee Sheriff's Office, having fully demonstrated its voluntary commitment to law enforcement excellence by living up to a body of standards deemed essential for the protection of life, health, and safety and the rights of the citizens it serves, and having exemplified the best professional practices in the conduct of its responsibilities, is hereby, upon the recommendation of the members of this commission, awarded the certificate of advanced accreditation, and it is a meritorious award. effective on the second day of April 2026, and is recognized as an accredited law enforcement agency for a period of 4 years. Chair?
Thank you, Ransom. Appreciate it. Appreciate everybody and for the support for the commissioners have been great and the citizens of this county. Health and safety is their #1 priority, so thank you so much for his time and y'all have a great day.
Sheriff, if I can get y'all to come to the center and face this way, I'll take these pictures. I would believe how good a picture you can get from up here.
Got a good zoom lens on.
Yeah, I mean, you got the crowd behind you.
Where's the music like? Saw him walk in.
Yeah, Rick Wagner, would you like to come out here in front and take a photo as well? No pressure.
Everybody's watching, Rick.
We'll wait for you.
I'll take the lens cap off.
It's that little button right on top.
Thank you all, appreciate it.
Thank you all.
Thanks, Vince.
Next order, Hannah Taylor, the Executive Director of Sullivan County Regional Health Department.
So Commissioner Meeks asked me to do a presentation on the same subject we talked about last week, which was rural health transformation funds. Is that bad? Is that bad? No? Do I just need to talk louder? Okay, so Commissioner Meeks asked me to do a presentation on what we talked about last week with the rural health transformation funds. So I'm gonna be very brief and kind of dumb it down and keep it quick. Do I tell you next slide? So you can go on. So what is the Rural Health Transformation Fund? So essentially it's a $50 billion opportunity that is from the One Big Beautiful Bill. So all 50 states did apply and were awarded $1 billion over the course of 5 years. For the first year, the state of Tennessee has been awarded $206,888,882.11. So the remainder of the funding for the next 5 years is based on progress and performance of the projects that they do. So we won't have additional funding till year 2. You can go to the next slide. So vision for this project is better care closer to home. Essentially what they're wanting to do is get counties to maintain their independence and connect to stronger regional partnerships, modern technology, and shared resources that make care more accessible and sustainable. So essentially at its core, it's about building a system that's designed around rural Tennesseans and their needs and their challenges and their strengths. Thank you. So this is how kind of the funding was originated. So you have your One Big Beautiful Bill. Within that, you have the Rural Health Transformation Program eligibility requirements. Then you have the Governor Lee's funding priorities, legislative plans and priorities. And then you also have the Tennessee Rural Healthcare Task Force who was involved in this. That's a body of 34 individuals appointed by Governor Lee. It's different MCOs, the Tennessee Department of Health, different academic and healthcare agencies who helped create the eligibility requirements for this program. You go ahead to the next slide. So what they did is they created 5 pillars. These are the 5 pillars of the funding eligibility for the different grants. Within these 5 pillars, there's 17 different categories and then 45 different activity levels. So I'm not gonna read through these. You guys are able to read and you have my slides now so you can look at it. But sustainable access, innovative care, technology, making rural America healthy again, and then workforce development are the main pillars of care for this. You can go ahead to the next one. And so the biggest issue with this is that all sounds great, but they determined that 89 of the 95 counties in Tennessee are not eligible to receive this funding, and Sullivan County is one of those. So that is a declination based on Tennessee Department of Health metro status. That's how this came about. Essentially, I was told I could apply for any of these funding opportunities and I could be awarded them. However, I can't serve Sullivan County residents and I can't have it in Sullivan County. So I can apply for a mobile unit, we can drive it around the state of Tennessee, but it can't be in any of the 6 metro counties, and Sullivan County citizens can't access the funds. I talked to different organizations like Friends in Need and Valid Health, they're interested in these funds, as a lot of organizations are. Sullivan County citizens, if they get access to those, can't receive any of the opportunity. So just wanted to bring to mind the injustice and misrepresentation that that is to our citizens from across the state. And then I have one more slide, and that is from last week to this week, the number of grants that have rolled out from the program. So we've got 10 different funding opportunities that have already rolled out from this, with the dates that they start their application. So.
The floor is open for discussion. Recognize Commissioner Haynes.
Thank you, Mr. Chairman. Thank you, Anna, for a great presentation. I'm on this health council with her and several other people in the community in Sullivan County. But basically, we just want to be very clear that we are not wanting to get rid of our autonomy with our metro status. We just want to be able to be eligible for some of these things. There are things that we do apply for through the state. And so we don't have a solution, it's an ongoing situation, but this is just simply for information for everyone. So, thank you.
Anyone else seek recognition? Anyone at all?
Thank you.
Always a treat. Thank you very much. Our next order, we have proclamations. We have 4 proclamations, and this is something that we've always enjoyed to do. It's a great moment of goodwill in our community, and I'm going to ask our incoming mayor, current chairman pro tem, to join me in well to read the proclamations, and I will bring them to me, and we'll present them in the order that I have them in my hand. I'm not sure what I have, so did a little shuffle. It's a proclamation honoring Destiny Wilson.
Proclamation honoring Destiny Wilson in recognition of the outstanding leadership. Whereas Destiny Wilson has diligently performed important research in microbiology for about 2 years with a focus on antibiotic research, a serious threat to our very lives, and where Destiny, having drawn accolades from her research mentor in February of this year, was nominated to present her research findings at the state level. And whereas she continued to research and conduct experiments using the research to craft a poster to present her research. And whereas subsequently become one of only 7 students from East Tennessee State University chosen to present her research in poster form in Nashville on April 8th, 2026. And whereas Destiny's final project explains her experimental procedures, what her research is, how important it is, and the future direction of my research. Whereas antibiotic research is not as well known as it should be, and it most definitely does not have enough preventative methods against it. And whereas if bacteria keep adapting to our well-known antibiotics, we will have none left to treat even simple bacterial illnesses like foodborne infection. And Destiny has focused on finding antimicrobial agents in specific bacteria to combat other types that are known for causing infectious diseases. Now therefore be it resolved, on behalf of the Board of Commissioners of Sullivan County, hereby commend Destiny Wilson for outstanding achievement in service to her community and fellow man for her continued determination and tenacity in pursuit of medical research to help prevent and treat serious illnesses. And whereas this proclamation is adopted on the 21st day of May by Sullivan County Commission. Destiny, congratulations.
you may, remember former Commissioner Terry Harper Rose. This is his sister. Terry and I were birthday buddies, May 18th. Terry and I, we always celebrated that together.
I know, great, grand, neighbors, great neighbors, see fish and. Thank you much.
And I like to say about our next recipient proclamation, Miss Eliza Sanders. I told her at the first meeting, as young as she is, she and I are old friends, because she is like two-time Miss Sullivan County, and we done like events together. Next month, this is actually in commemoration of Eliza Sanders Day. Next month, she'll tell you where she's gonna be next month, but, I'll give you the proclamation.
Congratulations. Sullivan County Commission proclamation honoring Eliza Faith Sanders. Whereas June 16th marks the birthday of Eliza Faith Sanders, a distinguished resident whose life and service has made a meaningful impact throughout Sullivan County and the state of Tennessee. And whereas Eliza Faith Sanders has demonstrated years of dedication to Miss Tennessee organization, exemplifying the values of service and scholarship while serving as an influential role model for young women across her community and state. And whereas through her community service initiative, Families Are Forever, Eliza has passionately advocated adoption and foster care, working to ensure every child has opportunity to experience the love and stability of a forever family. Whereas she has engaged with numerous schools, civic groups, and organizations across the country and state, educating individuals of all ages on the importance of supporting children in foster care and promoting the understanding that families come in many forms. And whereas Eliza has patterned with the Isaiah 117 House, serving as their youth ambassador to support children facing difficult circumstances, including organizing donation drives that have raised thousands of dollars and collected thousands of essential items to provide comfort, care, and resources for children entering foster care. And whereas her commitment to service includes organizing other fundraisers, supporting numerous nonprofit initiatives, and reading to thousands of students over multiple years, encouraging literacy, confidence, and cultural awareness. And whereas throughout her tenure in the Miss Tennessee organization, Eliza Faith Sanders has represented Sullivan County with grace, compassion, integrity, and leaving a legacy of service and leadership. And now therefore be it proclaimed that the Sullivan County Commission hereby acknowledges that June 16th will be annually recognized as Eliza Faith Sanders Day in honor of her birthday and in recognition of her outstanding contribution to leadership and dedication to strengthening families and uplifting communities. Be further proclaimed that all citizens of Sullivan County are encouraged to observe this day by supporting efforts that promote family, service, and community engagement. In witness thereof, this proclamation is adopted on this 21st day of May by the Sullivan County Commission. Congratulations.
First one.
Proclamation honoring Riley Shea Brown.
Proclamation honoring Riley Shea Brown. Whereas Miss Riley Shea Brown, a student at Dobbins Bennett High School, has distinguished herself through academic achievement, leadership, community service, and dedication to personal experience. And whereas Riley was crowned Miss Tri-Cities Tennis Team on January 24th, 2026, and will proudly represent the Tri-Cities region at the Miss Tennessee competition to be held June 15th through 20th, 2026 at Belmont University. And whereas she has demonstrated outstanding involvement in school activities, including mock trial, sparkle squad, color guard, yearbook, and cheerleading, while also earning her OSHA 10 certification through honors engineering studies. And whereas Riley has devoted countless hours to serving others through volunteer work with local churches, community organizations, Special Olympic events, scholarship fundraisers, holiday outreach programs, and initiatives supporting individuals with specific needs. And whereas her community service initiative focuses on suicide prevention and mental health awareness inspired by personal family experiences with the goal of ensuring others know they are not alone and that help and hope are always available. And whereas Riley Shane Brown serves as a positive role model to young people throughout our community through her compassion, leadership, faith, and commitment to making a meaningful difference in the lives of others. Now therefore, be it proclaimed that we do hereby recognize and commend Riley Shea Brown for her accomplishments, service to the community, and representation of the Tri-Cities region, and extend best wishes for success at the Tennessee team competition and all future endeavors. In witness whereof, this proclamation is adopted on the 21st day of May by the Sullivan County Commission. Congratulations.
Is there anyone here to receive proclamation honoring ALS awareness? Commissioner Carr actually brought that to us, so Mr. Carr, if you'd like to accept it, that's
Go ahead. Well, just,
he put the proclamation together and brought it to us.
Proclamation honoring ALS Awareness Month. Whereas ALS is commonly known as Lou Gehrig's disease, is a progressive, fatal, neurodegenerative disease in which a person's brain loses connection with their muscles, slowly reducing a person's ability to walk, talk, eat, and eventually breathe. Whereas thousands of new ALS cases are reported every year, and estimates show that every 90 minutes someone is diagnosed with ALS and someone passes away from ALS. Whereas, on average, patients diagnosed with ALS survive only 2 to 5 years from the time of diagnosis. Whereas, the exact causes of ALS are unknown, and there is no known cure for ALS. And whereas people who have served in the military are no more likely to develop ALS and die from the disease than those with no history of military service. And whereas securing access to new therapies, durable medical equipment, and communication technologies is of vital importance to people living with ALS. And whereas clinical trials play a pivotal role in evaluating new treatments, enhancing quality of life, and fostering assistive technologies for those living with ALS. And whereas ALS Association is the largest philanthropic funder of ALS research locally and has committed more than $154 million to support more than 550 projects across the United States and 15 other countries. And whereas the ALS Association is committed to make ALS livable and cure it for everyone, everywhere, and whereas ALS Month provides an opportunity to increase public awareness of the dire circumstances of people living with ALS, acknowledge the terrible impact this disease has on individuals and their families, and support research to eradicate this disease. Now therefore be it resolved that on behalf of the Board of Commissioners of Sullivan County, gathered here on the 21st day of May, 2026, do hereby proclaim the month of May 26 as ALS Awareness Month. I call upon all Americans to join in supporting ALS research, advocating for increased funding, and standing in solidarity with those affected by this relentless disease.
Thank all of you for being here. Our next order is public comment on agenda and non-agenda related items. And if you wanted to address the commission on an agenda related item or a non-agenda related item, there's a sign up sheet where Commissioner Cross is standing. If you'd like to address the commission on either one of those items, feel free. Feel free to sign up. We're going to adjust Commissioner Cross's pay per month. We're going to take him by the mile. He gets a lot of steps in here. Before I move on to the list, I'm going to read the rules of public comment. Pursuant to Rule 4 of our local rules, recess for 30 minutes for public comment. Each speaker is requested to state their name and address for the clerk's electronic record. Though this is not a question and answer, clarifying questions may be permitted. No speaker can transfer or yield time to another speaker. Each speaker will be allotted 3 minutes uninterrupted and is asked to direct all comments to the chair of the body and not the members. At the end of the 3 minutes, I will let you know and ask that you make your final statements. And right now, we only have one person signed up. Is there anyone else that wishes to sign up? Recognize Jay Baldor call you to the stand, sir. Name and address, please.
Thank you. Jay Baldoff, 449 Lakeshore Road, Love City, Tennessee. Come to talk to you about the volunteer fire departments currently have a staffing crisis going on right now. We had a call on Sunday that was a residential fire alarm. Normally that means that somebody left their stove on and the smoke detector went off, but this one was a full-blown house fire. Our fire chief took the truck and responded to the fire. Unfortunately, he was the only one responding to the fire. He had the truck, he just was one person trying to put out a house fire. Luckily, Bluff City came and brought another truck and responded with 2 other additional firefighters. And they were able to keep the fire under control and put it out. This is not an uncommon situation. We have problems with Sullivan County. Most of the upper end fire departments are having lack of response and having to result in mutual aid calls going out so that multiple fire departments are coming and having to put out the fires. So far, we haven't had a problem where nobody's responded and an entire house is burned down and caused any fatalities. But we're getting really, really close to that. And we need to look into how we can get more volunteers. My department basically made me go to different classes and symposiums and things like that, trying to figure out different things. Came up with a couple of reasonable solutions. One is a length of service award program that basically is like a retirement program for volunteer firefighters. It's something that Tennessee already has in existence. It was put into existence in 2022. Sullivan County would just have to participate in it. The entire cost of the program would be less than $50,000 a year. The second thing would be to do a reduction in property tax. Reduction in property tax for volunteer firefighters would be about a 20% reduction in property tax. And with the amount of volunteer firefighters that we have in this county, you're looking again at about a $50,000 package that would reduce the property tax by about $50,000. I need to have 2 resolutions to basically go ahead and present this to the commission, and I've been pushing to get my commissioner, Joyce Crosswhite, to write these 2 resolutions, and I've been running into problems because she doesn't want to do that because of the fact that we have a tight budget and don't want to increase property taxes, and you could stick your heads in the sand, but what's eventually going to happen is you're going to have a fire, a house is going to break, and it's going to burn down. God forbid somebody's going to die in that fire, and you're going to have to come up with a paid fire department, and it's not going to be pennies on the property tax, it's going to be dollars on the property tax. So I need one of the 22 of you that are here to step up and help me write a couple of resolutions to get this passed. Thank you.
As stated, this is not a question and answer, but Commissioner Locke has pushed his button, I'm sure, for a question that he may have. Is that okay with you, sir? Commissioner Locke.
Thank you. You got a fire association,
Correct.
and you got a chief in the department you.
Correct.
in. That needs to go through the association.
The
If we ran, what I'm getting at, if we ran a resolution, particular to what you just stated, we would have all kinds of members from each and every department coming up here wanting us to run resolutions.
This resolution would be blessed by the president of the association, Ben Wexler, or talk to him about this.
Ben needs to be in touch with us. He's the president, and we need to hear it from him. Okay? Thank you.
Okay? I'll get Ben to do this, but he basically told me to do it.
Tell Ben to call me.
Okay?
Anyone else seek recognition? Sure, thank you for being here with us, always. Thank you for being here, sir.
No problem.
Didn't mention that in the budget.
Anyone else wish to address the commission for public comment? Seeing none, entertain a motion for public comment to close. Motion by Commissioner Akers, second by Commissioner Cross. All in favor of closing public comment, say aye.
Aye.
Without objection, public comment portion of the agenda is closed. Next order is approval of the consent agenda. I'm going to read the consent agenda. We have items 2, 3, 4, 5, 6, 7, 9, and 11. 2, 3, 4, 5, 6, 7, 9, and 11. Recognize Commissioner Carr.
Thank you, Mr. Chairman. I'd like to pull item number 5 off consent list.
Commissioner Carr removes item number 5 off the consent calendar. Any further discussion on the consent calendar? Any further discussion on consent calendar? Motion to approve by Commissioner Crawford, second by Commissioner Akers. Without objection, when the board opens, please cast your vote on the consent calendar requiring unanimous consent. Has every member voted? Does any member wish to change their vote? Madam Clerk.
22 yes, 2 absent.
Thank you, Madam Clerk. Having received the necessary majority of the votes cast, the consent calendar is approved. The next order of business, under old business. Under old business, recognize the young man, Commissioner Sullivan.
Thank you, Mr. Chairman. We're gonna roll this, resolution out to next month, so we get a little better feel on the, budget.
Commissioner Stevens moves to defer item number 1 to next month's calendar. Without objection, that brings us to the end of old business. Recognize Commissioner Carr on item number 5.
I was gonna pull the resolution.
Commissioner Carr moves to withdraw item number 5. Without objection, under new business, recognize Commissioner Hager, item number 10.
Well, never mind, too late.
8.
8. Oh, excuse me. Recognize Commissioner Crossline. Not in a hurry or anything, just on the roll. Recognize Commissioner Crossline.
Thank you, Chairman. This resolution is to authorize the Sullivan County Purchasing Department to seek, be changed it from bids to quotes to demolish and remove the building once used for shop classes and located adjacent to the former, local middle school. In other words, the old rock building. This building is, disrepair low and needs to come down, and it's not a historical status, so I would want you to go ahead and do this on waiver rules, and let's get it out of here.
You've heard the explanation on item number 8. The floor is open for discussion on item number 8. Sponsor moves waiver rules requiring 16 votes for passage. Recognize Commissioner Hopper.
Just a quick question, thank you, Commissioner Gardner. In the event that your bids exceed $33,000, what would be the provision for that if none of the bids were under 33?
I think that we've pretty well got it solid that it can be up to 33.
Okay, thank you.
Thank you.
Recognize Commissioner Crawford.
Mr. Chairman, what's the plans for the use of the property once it's cleared off?
The building committee, we just left before we came down here, maybe a farmer's market, onto phase, on our next phase 2 of the block of campus. So it could be a covered farmer's market for one thing.
Anyone else seek recognition? Anyone else? Mr. King.
Thank you. The exact location, we talked about a farmer's market, a venue, I think that's the new name, isn't it? Mayor, venue. But anyway, that's, where the rock building is closer to the library. If we take all that down, it's on a steep slope. We'll level that, or there has been some, questions about, maybe building a building back in that bank where it was and use it to store stuff for, I think EMS is wanting something, maybe their trailers, some of that stuff that they have to have and they need a place to store it. But anyway, it would be on
the south side of where a venue would be, it'd be kind of the outside part of it. And that's all in phase 2 of the plan for that whole area back there, which, you know, we haven't really decided, you know, in concrete what plan we're going with. We're just looking at ideas right now, so. But anyway, that is the part of, Plan B, I guess, would be the best way to say it. So, anyway, thanks.
Commissioner Crosswhite.
I will go with my waiver rules, and if anyone else has any more questions, and that's it. Thank you.
Sponsor renews a motion to waiver rules on item number 8. Without objection, when the board opens, please cast your vote, requiring 16 votes for passage. Waiver rules. Has every member voted? Does any member wish to change their vote? Madam Clerk?
22 yes, 2 absent.
Thank you, Madam Clerk. Having received the necessary majority of the votes cast, item number 8 is approved. Now, 10. Recognizing Commissioner Aker, on item number 10.
Thank you, Chairman Pro Tem. Thank y'all for discussing this last week when I couldn't be here, and I apologize. So I'm not gonna read through all of it, but it is another exciting tip development project going on in Bristol. Across the street was one of the first tips in the county that was approved years ago. Of course, it has done extremely well, and now they're gonna give a little competition. And I'll be honest with you, I never thought an Aldi food store would have the people so excited. But to get the emails that I know my commissioners and I have gotten about it, has been really exciting to see. And so, development there, they're looking to go vertically, so that's why we're asking waiver of rules tonight, so they can try to be open by the holiday season. And I didn't realize, I'm sure it was discussed last week, Tom, or something, but what an average Aldi's does in revenue and tax. And so, appreciate your vote on this, and obviously everyone favors, the affirmative will be a co-sponsor on it. Appreciate it.
You've heard the explanation on item number 10. The floor is open for discussion on item number 10. Anyone seek recognition?
Yep, waiver rules.
Sponsor moves waiver of rules on item number 10, requiring 16 votes for passage. Without objection, when the board opens, please cast your vote on item number 10. Has every member voted? Does any member wish to change their vote? Madam Clerk?
22 yes, 2 absent.
Having received the necessary majority of the votes cast, item number 10 is approved. Without objection, recognize Commissioner Ward on item number 12.
Thank you, Mr. Chairman. This is a resolution appropriating $177,043 from the opiate abatement settlement fund for the Sullivan County Sheriff's Office Medical Division Mental Health Program. Mackenzie, would you be mad at me if I had you come up? I really don't want to butcher this. She's the expert at this, and I'm gonna let her explain it. She knows more about it than I do.
Absolutely, thank you so much. I'm Mackenzie Coleman, Director of Mental Health with the Sullivan County Jail. Just want to give you a brief update on what we've been able to do the last year with this program. It has been really just, for lack of a better word, a blessing to our jail. When our long-term mental health hospitals closed down across the nation, the result of those doors closing were those individuals have ended up in our county jails. And our health administrator, Christy Frazier, and I fight this battle every single day. These inmates are sicker in mental health. There is no help for long-term mental health. Here in our area, across the state, nationwide, so their home has become the Sullivan County Jail. We are working on ways to advocate for them, give them better treatment. So with this money, between the months of July to February, we were able to serve 823 inmates with our mental health services. This money helped us to hire a very experienced, very knowledgeable psychiatric nurse practitioner with decades of correctional healthcare experience, hire a nurse to help. And so we have been providing stabilization for these inmates in the jail instead of having to burden our transportation division. The closest place for stabilization is Moxon Ben Hospital in Chattanooga, which is about a 3-hour commute one way. So this has relieved the burden on our transportation division and been able to do medication management, stabilization inside of our facility. So we are so grateful for your all's support and continued support. And fiscally speaking, I think it's a very responsible use of the money. We were not required to add this to our budget or a tax increase. So I intend to come back as long as this opioid abatement money is available to our county and ask that you all do continue to support this program. And I'll be excited to come back every year and give you the reports of these numbers. I think 823 inmates with a little over $150,000 is a good use of these funds, so I appreciate it. Any other questions?
Anyone have any questions? Anyone seek recognition? Recognize Commissioner Iverson.
Thank you, Kevin. This $177,000, does that get us a full year, or how long will that run until you're running out?
It does. It gets us a full 12-month salary for those 2 positions. The others are needed things like drug screens and things of that sort for the program, but that is 12 months of salaries for both positions.
Okay, thank you.
Recognize Commissioner Means.
Thank you, Mr. Chairman. How close did you say was the closest mental health facility?
3 hours, Chattanooga, Moxon Ben Hospital, and I am lucky to get 72 hours out of hospitalization for these inmates. There is no long-term, so that is a short-term fix, and then in about 72 hours, we have to turn around and drive another 3 hours, which requires overtime. So that's been a great help to us to be able to do some of that in-house.
Sounds like a great cost savings.
Absolutely.
How many inmates did you say?
Between July and February, we served 823 inmates.
Commissioner Rain.
Thank you, Chairman. Hello, Ms. McKenzie. I don't know, obviously, I think she said a couple things here, because I think, didn't we not used to have a place in Greenville and in Knoxville before they shut down?
Lakeshore?
You may be too young for
Yeah.
that.
If you're referencing Lakeshore, I believe that closed in 2012, if I'm correct on that date. We do not have those facilities any longer. Woodridge has a lot of parameters in place to prevent. The criteria totally changes for an inmate versus a free citizen for mental health care, unfortunately. A lot of barriers are in place for incarcerated individuals. So that is our closest, is a 3-hour commute.
Yeah, then what, I just think this is probably a bigger subject of the issues that we have there. Right?
Absolutely.
For you and Ms. Frazier.
Absolutely. We fight it every day.
Yeah. But I think I'd tell you to come back every so often and check in with us.
Absolutely, I'd be happy
You
to.
know?
Be happy to. We're very proud of this.
Yeah.
Christy and I advocate for mental health. There's true severe and persistent mental illness, and it is so evident. Aside from any drug usage, not high.
Now, do you all have to confirm, like, how does that work? I've just got a lot of questions, so maybe off the record.
Sure.
Who decides if they're mentally, I guess, unfit?
So having this nurse practitioner to do a clinical assessment on them, she is able to diagnose. But these people do come in with prior treatment from community providers a lot of times. Non-compliancy, which leads to off medications, which leads to charges, therefore the resulting arrest at the jail. But the problem that we have is there's no place to send them, no long-term, we need long-term lockdown mental health units for these individuals. It's not someone that we could give these resources to that are available and they'll be successful. They require 24/7 care.
Good luck, be safe.
Commissioner Hall.
Thank you, sir. Just out of curiosity, what's your recidivism rate of these folks that you're dealing with? And it sounds to me like the numbers that you presented is the entire population or capacity of the jail. So are all these people within the jail system, or are they incarcerated, or are they part of the?
So that's twofold. A lot of repeat offenders, due to no housing. So once they've served their 30 days on a misdemeanor charge, they're released back to the streets to reoffend we see a lot of mental health with trespassing, disorderly, a lot of public intoxication charges due to their behaviors because of their mental illness. Then on the other side of that, we have individuals who have been incarcerated there for years, due to them being a threat to society and nowhere for them to go. So yes and no. There's repeat offenders. As far as the 823 inmates, these numbers could be the same inmate, multiple contacts based on multiple arrests. So yes and yes, long-term and repeat offenders.
Thank you.
Anyone else seek recognition? Commissioner Ward?
Rep waiver rules. Mackenzie and Christie do an awesome job, man. Thank you for being here, man. Appreciate you.
Sponsor renews his motion for waiver of rules on item number 12. Without objection, when the board opens, please cast your vote on item number 12. Waiver of rules requires 16 votes for passage. Thank you all for being here. Has every member voted? Does any member wish to change their vote? Madam Clerk.
22 yes, 2 absent.
Having received the necessary majority of the votes cast, item number 12 is approved. Without objection, recognize Commissioner Carr on item number 13.
Thank you, Mr. Chairman. This is a resolution to appropriate $216,000 from the opioid abatement settlement fund to the Sullivan County Sheriff's Office Co-Responders Program. And we have two special guests with us here tonight to talk about that. We've got Captain Andy Siebel with the Sullivan County Sheriff Department and Captain Jimmy Dillard with Bristol Police. So y'all would like to come up and say a few words about it?
While they're coming up, you've heard the explanation on item number 13, and the floor is open for discussion. Mr. Siebel.
Thank you all. We've also got Wendy Griffin, co-responder from Bristol Police Department that works with us. This program, the sheriff became aware of it and got to looking into it, and after he spoke with Jimmy here, he said, we need to have this program. And we got to looking into it. This is gonna be a big game changer for Sullivan County. And I can't do it justice. This man right here gave us a presentation that was off the charts. And I'm gonna let him speak. He has a wealth of knowledge about this program. And we would model ours just as if what they're doing there. So.
Thank you.
Thank you. My name's Jimmy Dillard. I'm the patrol captain of Bristol, Tennessee Police Department. We found out about co-response. We got a city manager from Minnesota, and they had co-response in Minnesota. And basically what it is that they embed clinicians, mental health workers in the police department to respond to calls anytime we think somebody's suffering from a mental illness. Police One recently released a statistic that said approximately 20% of all calls we go on as law enforcement, we deal with somebody who has a mental health issue. That being said, in the city, we responded to 40,000 calls last year. So 8,000 calls, based off that percentage, we dealt with somebody that was suffering from a mental health issue and probably a substance abuse issue. You know, as a police officer, we're limited in what we can provide for these people. So it goes to what she said. A lot of times, if we can't get them to voluntarily go to the hospital to seek treatment, that's tough to do, trying to convince somebody suffering from mental illness to go to the hospital and try to get help. So if we can't do that, our only other option is to put them in handcuffs if they're a danger to themselves and others, and take them to the hospital for an evaluation. If they don't meet that criteria, or if they don't voluntarily go, we can't do anything. So that's where the co-response comes in. You know, we get a call about somebody who's suffering from a mental health issue, somebody that's suicidal, Wendy or her partner Monica will be in the car with one of our rovers. They'll go to that call. We'll get out on the scene. Once it's safe, we step back and let her step up and talk to the people. She can evaluate the people in the field. She can look at somebody in the field and make a determination that person needs to be committed. In addition to that though, she says, actually you step up here and talk about it.
So part of our program, we are mandated pre-screening agents, which allows us to assess persons in the community and decide whether or not they need to be held for an involuntary commitment in order for them to be evaluated for further treatment. So that is something that we do that the officers couldn't do before. But we also provide resources and connections and services for these people who may otherwise not receive these things. They could be homeless, they could be persons that we run into in a call for a domestic or even a car accident, that we're there and we're able to speak to them to provide them resources to get them connected, to follow up with their clinicians or their doctors or things like that to make sure that they have continuation of care and follow up. And we will go out and call them back or go and see them again or drop by if they don't have a phone to follow up to make sure that they have what they need and they're going in the right direction if we're not taking them to the hospital.
So the whole purpose of having them in the car with us is we want to divert the people from jail and we want to get them the help they need, right? Prior to co-response coming to Bristol, what would happen, we would get on scene, we're trained on how to talk to the people, but we're not therapists. We can't diagnose, we can't send them places. So we would get on scene, they wouldn't be a danger to themselves or others. They wouldn't want to go to the hospital voluntarily, so we would clear the call. We'd get called back out there 9 times, and eventually they'd violate the law. So the only option we would have is take them to Sullivan County Jail. It's unfortunate. I've been in law enforcement 20 years. This is the best thing I've seen by far. I don't know how we got by without, to be honest with you. I don't, and if you're not familiar with a lot of cops, we don't like change. We don't like people stepping in doing their job. But everybody at our department, every officer has nothing but positive things to say about them. They make our job easy, and they're providing a better service to our citizens. When we do, cops, without her, or without me, Monica, take somebody into protective custody, we gotta transport them to the hospital. We sit out there with them for 8, 10, 12 hours, waiting for somebody from Frontier to come evaluate them. It's just a manpower nightmare. Ultimately, in my opinion, we come down in the city to whether we pay for it on the front end to try to get these people treatment, try to get them help, try to get them on medication, try to get them with counselors, or ultimately we're going to pay on the back end on their jail. And we decided on the front end we're going to address this issue. Oh yeah, I was looking at numbers before I came. We started in January 2025. Monica and Wendy have ran over 1,200 calls, and out of 1,200 calls dealing with tons of people, we've arrested 17 people. Wow. There's no way to really put a number on how many we would have arrested prior to them, but I can promise you it would have been a whole lot more than 17.
Are y'all open for questions?
Absolutely.
Recognize Commissioner Hayden.
Thank you. Well, a couple things there. Anybody knows who Jimmy, for him to say this is the best thing they've ever seen, because they're right. I mean, what little we all know or think we know about police activity and all that, they are reluctant to change, and rightfully so. So I won't say shocked, but pleasantly surprised to see. What I'm really curious about, and Captain, it is Captain Steve Bolden, yeah, mentioned how he was blown away by the presentation. We're in a huge, I don't know if there's funding that's gonna be done tonight, but I'd love to see that presentation.
But it was what he told us, there was.
Yeah.
There
Oh,
was
okay.
PowerPoint.
Yeah, no, I was expecting it, I mean, because the way y'all talking about it, and to be that way, yeah.
It was just me talking. I'm passionate about it because I've seen it work. Major Johnson, he's been in law enforcement 37 years. He's the old school guy. He don't want help from anybody. And, he said this has been a godsend. This has changed policing. You know, the people we go out and deal with mental health issues, we've had to arrest before. It hasn't been in the best circumstances, so we take a step back and they're talking to her. They're open to her. They just don't want to talk to the cops, a lot of them. In addition to that, something that I've seen it help us in ways I never imagined is when we have tragedy inside the department, when we have an officer going through a tough mental health issues, having problems, go on a bad call, involved in a shooting. They don't want to talk to somebody on the hotline. They don't want to talk to somebody they don't know. They want to talk to Wendy or Monica. They trust them. They're embedded in the department. They're one of us. You know, I can't brag on them enough. It's been a blessing.
All right, so I'm gonna ask, how reluctant were you when it got started?
I think we all were really.
Yeah, I'm just surprised. I didn't know this was on the pod tonight. I don't really.
Yeah, I think we all were. Again, we like, you know, most police are alpha, got that alpha personality, and they don't like people stepping in, and they've been awesome. I'll get out of the way and let her handle every call. I don't care. Oh yeah, Officer Thomas is here too. We brought him along. He rides around in the car with Wendy and Monica a whole lot. If y'all like to ask him anything, he can give you a perspective from the line level guy.
Commissioner Locke.
Thank you. So on voluntary transports, do you all transport to hospital or do you all call out Bristol, Tennessee Fire to do that transport?
So if they just want to go to the hospital themselves, no medical issues whatsoever, we'll transport them out there and drop them off. But if it's any medical issue at all, Bristol Fire Department will come transport.
Okay. So substance abuse, suicidal ideations, you all will take them?
We will, yes, sir.
All right, thanks.
Commissioner Hopper.
Thank you. It takes the most unique person to do what you're doing. And were you a part of the police department prior to doing this, or you had background training and became a police officer? So I'm just curious about your story a little bit, if you don't mind sharing it.
Sure. I'm a licensed clinical social worker. I'm originally from Louisiana, but I spent most of my career working with police with child protection. And then I also ran a civil mental health board in Louisiana prior to moving here and joining the team here to be a co-responder.
Welcome to the community.
And to add to what you said, asking about her, it takes the right licensed mental health workers to make this work. You gotta get somebody who can work from the department, build relationships with people. We didn't want them to be responding from somewhere else where it was just like a resource we reached out to. We wanted them to be one of us. So her office is like 100 feet from my office. She's there in patrol. Anytime somebody comes in, if she's there, she sees them. She's in the park most of the time. But just getting the right people on the team helped it tremendously. Frontier Health is excellent to work with. They allowed us to be part of the interview process when they hired Wendy and Monica. It's just a great partnership.
Commissioner Crossline.
Thank you, Chairman. Thank you all for bringing this forward again. I enjoyed your presentation when you came to the opioid committee. This is going to be wonderful for Sullivan County, and I want to give everybody an update. Since I'm the chairman of this committee, we have spent $890,000 and 546 cents towards mental health of the sheriff's department, and I'm proud of that. So thank you all for doing these jobs.
Commissioner Ward.
Thank you, Chair. Thank you, Captain, for being here. A couple of things, just points I want you to talk about a little bit, how they are paid, contract process, through Frontier Health, and a little bit about what equipment-wise is needed for what they wear.
Yeah, so they're employees of Frontier Mental Health. We were blessed initially. I applied for a federal grant. We didn't get it because we were competing with like Memphis, and we didn't have enough stats for it. But we spoke to Frontier about what we wanted to do here, and they were impressed with it, so they reallocated one of their workers to our department, so they pay completely for one of them. The second one, we was able to use the abatement money in the city of Bristol to pay for Wendy's position. They get hired by Frontier Health after we go through the interview process. They get trained through Frontier, they handle all that stuff, all those expenses. I pretty much provided an office, a desk, a computer, a bulletproof vest, a radio, and also the vest she's wearing tonight is not what we're going with. We ordered a gray one for her, but it somehow got lost and hadn't come in yet. It says, mobile crisis on the back. We want her to look different than what we do. But that's pretty much it. They invoice us, monthly, and they said they could invoice us quarterly or monthly. We chose to do it monthly, and we, pay them back for Wendy's position out of the opioid money for the city of Bristol.
Bring one sponsor, Commissioner Carter.
Waiver of rules, please.
Anyone else have any questions for our guests? Commissioner Edwards.
Sorry, I didn't know I had so many questions tonight about mental health. So Bristol's doing it, we're looking at doing it for Sullivan County. What, are there other areas that are doing it around us?
So the only other area around here, well, Bristol, Virginia does it, but they kind of have a different model. Everybody has a different model.
Well, Virginia's weird anyway.
They are, they are. Washington County, Tennessee has 2 workers, but they keep them in the jail. In my opinion, I think we need to get into the community and prevent them from going to jail. It's kind of, in my opinion, the best way to use that fund.
Without objection, Commissioner Carr renews his motion for waiver of rules requiring 16 votes for passage. When the board opens, please cast your vote on item number 13. Require 16 votes for passage. Thank you all for being here. Has every member voted? Does any member wish to change their vote?
22 yes, 2 absent.
Thank you, Madam Clerk. Have you received the necessary majority of the votes cast? Item number 13 is adopted. Without objection, recognize Commissioner Locke. Item number 14.
Thanks, Chair. This resolution is for a pilot for KHRA for the redevelopment of Poplar Dale Road. It's the old Lee property on East Superior, downtown Kingsport. I've got Joel Compton here. Do y'all have any questions? He can answer that. BMA voted on this in April 21st meeting and approved it, and they're just waiting on us to approve our part, and we'll go over any questions y'all may have.
You've heard the explanation on item number 14. The floor is open for discussions. Sponsor moves waiver of rules on item number 14, requiring 16 votes for passage. Mr. Conlon, you're recognized, sir.
I'll just say a few words. This is the former lease side, as Mr. Locke said. That has been a vacant area for some time now, where the Housing Authority submitted a tax credit application to redevelop that in phases. The first phase is about 55 units. They're hopeful that they'll get an award this year and be able to rebuild there. The pilot agreement is just a necessary part of that because ownership does transfer to a new ownership entity in the tax credit program. KHRA will still be the manager of these properties and still basically have control, but for tax reasons, the ownership has to be transferred. All of this property is currently owned by KHRA or its affiliates, so it's not currently on the tax rolls, so there's no decrease in taxes. In fact, there'll be a small payment under this pilot agreement, possibly. It's a formula, so sometimes the money's due, sometimes it's not.
Anyone seek recognition? Anyone have any questions?
Anybody voting yes, affirmative, just listen, let's co-sponsor.
Anyone seek recognition? Without objection, sponsor renews his motion. For waiver of rules requiring 16 votes for passage. When the board opens, please cast your vote. Item number 14, waiver of rules.
I'm glad to see that. Yeah.
Has every member voted?
Thanks, Joe.
Gary, stand out.
I hate to move on because here's, will just make me very uncomfortable when he knows that.
Everybody stand.
Everybody just stare at him.
That's how I feel.
You passed.
Okay, I wasn't sure what was going on myself. Thank you all.
You can't do that nationally,
In Nashville, they call that ghost voting. Has every member voted?
Yes.
Yes.
Any member wish to change their vote? Madam Clerk.
22 yes, 2 absent.
Having received the necessary majority of the votes cast, item number 14 is adopted. That brings us to the end of our calendar. Next order is announcements. You want to see recognition for announcements? Commissioner Jones.
We had a really good conference, in Gatlinburg this past week. Two of the main topics that were discussed were the retirement plan, and there are some new options going to be available. I think it behooves us, and even though he was up here, I understand a couple of weeks ago, to speak there was, to understand, for the commissioners to understand what the retirement system in Tennessee has. We are the number 3 in the nation with about 75 billion in our retirement fund. We're recognized for nationwide for and as commissioners that are available, you have an opportunity for that. The other thing, and I think it really probably shook us a little bit that watched it, the presentation, is ADA compliance for websites. It's real scary what attorney groups, sorry, man, no reflection, are out there attacking organizations. And you think about ADA, we always thought about walking, physical, but no, somebody goes on our website and something is different shades of gray, they can't read it because of their vision. That's just a really small example of what's going on. So this is something every government entity and business, private business, is going to have to face. And I would just encourage you to find out more about it. Larry and Sonny, Mark, Travis, and I, Gary. Heard some really interesting information. August will be the cup-up, which is in Murfreesboro for the newly elected commissioners. You need to go to that and find out. And then October is our next fall conference, I think also in Murfreesboro. But anyway, a lot of information that's passed out. Thank you.
Commissioner Jones, you have the dates for that August meeting.
No, I didn't bring that.
I believe it's 24th, 25th.
I think so.
Yeah.
Commissioner Rader.
Thank you, Chairman. Couple things, so for those of us that work on a budget, it is gonna be a tight budget. We've had some big increases. Sam didn't go into it, but with retirement and health, this year is hitting between 7 and 10% increases. So those are gonna be pretty rough. And then, I was hoping Jay was still here, I was trying to look for him. And I agree with what Hunter was telling Jay was, on Monday, Ben Wexler presented to the budget committee everything, and everyone's mentioned any of those issues. And those kind of things, what Hunter was trying to explain to us, needs to come from the President Association. And, we literally had a great conversation with them on Monday, and none of that was mentioned. And so, I don't, hey, that Jay called a commissioner out by name on that, and, but there's a proper way to do things, and I'm glad that's what was mentioned there before, so, thank you.
Anyone else seek recognition?
Adjourn.
Have a motion to adjourn, all those in, Clerk Jacobs.
I wanted to, encourage all of you to go see the Liberty Celebration, or the Liberty, what is it called, the Liberty
Liberty Celebration.
Yeah. I had never heard of it, and when I ran for office the first time in 2018, someone asked me if I would be interested in going and handing out programs. And they said, is it you'd be helping us? It's a great way to meet people. So I said, sure. Wow. I was blown away. I sat there through that performance. If you love America, you need to go see it. I sat there with chill bumps on. I'm getting them now. I sat there with chill bumps on me, and it moved me so much. And I have been back every single time.
Where's that?
It's at the Toya Free,
Yes.
Yeah, tell us, Commissioner Jones, I think.
Liberty Celebration is an event that takes place every 2 years. The person that sat in this seat prior to me was very involved with it. But it's a over 100 voice choir, full orchestra, a lot of community involvement in different ways, doing presentations on stage. The first performance is on Friday the 26th at 6 p.m. This is at the Eastman Employee Center. Seats about 1,500. It's usually sold out. The second performance is on Saturday, and I think it's at 2 o'clock. There is opportunity for anybody to be interested in supporting it, and I think I spread those on the desk earlier, meeting back. If you wanted to do an ad, if you wanted to say thank you to your supporters, as far as that being in the positions we're in. There will be displays of different organizations in the foyer if you've ever been in the Eastman Center. A lot of military groups, military affiliated organizations, but a lot of work goes into this by the community and the directors. So, June. Last Friday and Saturday in June. And you can get in touch with me if you need tickets. They're $5 each. Thank you.
Yes, sir.
Commissioner Crosswhite.
Thank you. I wasn't gonna bring this up, but this is Memorial Day weekend, and they did an interview. If you're up tonight at 11 o'clock, please watch it. It's in honor of my brother, but he's not the only one. And we have another gentleman from Blytheville that was also killed, Michael Har, so please remember his family. But that's why we do what we're doing for this county, is for people like him, so thank you all.
I'd like to thank everybody for checking on me and my family this week. I know you've been in the hospital, it's been a rough week, and thank God of it. A few months ago, we had a motion to adjourn. Is it still out there? All in favor, aye? Adjourn. Thank y'all very much.